Go.
Okay, so spina bifida, which literally means cleft spine, is characterized by the incomplete development of the brain, spinal cord, and/or meninges. It currently affects 166,000 individuals in the United States alone.
There are 4 types of spina bifida. Ranging from the mildest to the most severe, it is occulta, closed neural tube defect, meningocele, and myelomeningocele.
The most severe case is myelomeningocele, where the spinal cord is exposed.
The symptoms vary according to each type of spina bifida. There are no symptoms for occulta. When it's a closed neural tube defect, the baby will have a clump of hair, small dimple, or birth defect on the area of the spina bifida. For meningocele and myelomeningocele, the baby will have a visible, fluid-filled sac. For meningocele, the sac has a thin layer of skin on it.
These clearly show the difference between the types of spina bifida. Spina bifida affects the cerebellum as well as the spinal cord.
So no one actually knows the causes of spina bifida, but scientists do believe that some factors involved in its development are genetics, nutrition, and environment. Research studies indicate that pregnant mothers without a sufficient folic acid intake are more at risk of giving birth to a baby with spina bifida.
In most cases, spina bifida is diagnosed prenatally, which means that the baby is still inside the womb. However, in spina bifida occulta, it is usually diagnosed after birth by having a CT scan, MRI, or an X-ray. Unfortunately, there is no cure for spina bifida. Any nerve tissue that was lost or damaged can't be repaired or replaced. Therefore, damaged nerves can no longer function. Luckily, there are treatments for spina bifida, but they vary depending on the severity. With mild spina bifida, no treatment is needed, although some surgery may be required as the person grows. In most cases, children will have surgery to close the defect and minimize the risk of infection. For children with severe cases that are diagnosed prenatally, the spina bifida can be treated by opening the mother's abdomen and uterus and sewing shut the opening. Though there are risks to the fetus and the mother, the benefits outweigh them, as a study of prenatal and afterbirth surgeries show that the kids with prenatal surgery have more developed brains and can walk better than the afterbirth surgery children. Children with spina bifida can be very active, no matter what type of spina bifida they have, as long as they start young. Their intelligence is normal, and most of them can walk with assistive devices. Some famous people who have this disorder are
Singer and songwriter John Cougar, poet and world record holder for longest wheelchair wheelie Robert Hensel, artist Frida Kahlo, and wheelchair racer and Paralympian Dame Tanny Gray.